Hello, my name is Amanda Broughton, and today I'm going to be talking to everyone about lung cancer. In January 2014, my mom was diagnosed with stage 4 lung cancer. This was not just any cancer, it was a fluid cancer that would never go away. She is considered to have a terminal disease known as a carcinoma, a non-small cell cancer with no cure in sight. How many of you know someone with cancer? I want to inform our audience about lung cancer and its effects it has on a person. We will look into lung cancer, who it affects, if it is hereditary, who is more likely to get it, and the treatments for cancer, and how it affects the person who has it. My mother has lung cancer that as of today there is no medically known cure, and has to do a rough round of chemo every 3 weeks to keep the fluid from coming back. I have sat and drained her lung and watched the cancer fill up a bottle. Most of us know someone who has been hit with cancer and know someone who knows someone. I would like to inform everyone of lung cancer in particular. Let's look at who lung cancer affects. Lung cancer does not discriminate. Both men and women can get lung cancer. Although people who get lung cancer are in their 50s, it can occur in people in their 20s and 30s. This is also the number 2 leading killing cancer in America. Someone who smoked for years and quit are more likely to get lung cancer than people who have never smoked. The people who have never smoked can get lung cancer as well. Now that we have looked at who can get lung cancer, we should look to see if lung cancer is hereditary. You tend to get cancer when you have a mutated gene. Hereditary lung cancer is more common in women than men. It is stronger in non-smokers than smokers. We've come to learn that lung cancer is indeed hereditary, but we need to speak of the hard part, and that is the treatment for lung cancer. What are the different options for treatments? Chemotherapy is an option for treatment. Chemotherapy is a treatment of the disease by the use of chemical substances, especially the treatment of cancer by cytotoxic and other drugs. It is run through an IV into your port and pushed at a certain speed for so long. The port is something that is surgically put into one of your main arteries. It helps draw labs from there as well as run any meds through. Radiotherapy. It is also called radiation therapy, which uses x-rays or similar forms of radiation. It can also be treated with surgery, where they remove a lung or part of the lung that is carrying the cancer. Sometimes they use all 3 treatments depending on the kind of cancer you have. Now that we've taken a look inside the many scary ways to get treatment for cancer, we should look into how a person with lung cancer is affected. Cancer can make a person feel depressed and alone. I have seen it happen to my mom, even though she has people around her all the time. Of course she feels alone, because none of us know how she is feeling or what she is going through. The only thing we can do is be there for her. It can harm a person health-wise. Although lung cancer can harm you, as well as put the cancer patient in pain, it makes it hard to breathe. The treatments are sometimes much worse than the disease itself. When you go through rounds of meds, you get sick. You lose weight, you lose your hair, and all of these make you feel really bad. You can be nauseous. It causes neuroptic, which is numbness of your feet and hands, vertigo, which is dizziness, migraines, constipation, and it speeds things along, such as menopause. I hope that you hear me reading this, you are understanding a little more about lung cancer. Today we learned about lung cancer and the many aspects of the disease. We looked at lung cancer, who it affects, is it hereditary, who is most likely to get it, treatments for lung cancer, and how the disease can affect a person who has the cancer. One final thought. My mom has now been through chemo for the past year, and every time she gets treatment, she wants to give up. The risks for lung cancer are getting higher and higher every day. I smoke even after she was diagnosed, and for me that's quite silly. I've been informed that my mom's cancer is hereditary, and I can get it 10 years earlier than she did. I hope that by telling you about this disease, you will think more clearly as you make decisions in your life.